You wanna know what is Calizion? Then don't forget to watch my full video because I'll be explaining more about Calizions. Have you ever realized that you actually have Calizion but you just think it's Thai, or in Malay we call it ketumbit? Okay, Calizion is actually a different eye pain than Thai even though they look just the same. A Calizion often starts out as a very small, red, tender, swollen area of the eyelid and is generally not an infection. In a few days, it may change to a painless, slow-growing lump the size of a pea and can be often confused with a stye, or we call it hordelum, which is an infection of an oil gland in the eyelid. Actually, Calizion can develop on the upper or lower eyelid and may disappear without treatment. Calizia is the term for multiple Calizion. Unlike stye, Calizion is able to emerge more than one in both eyes. Okay, so at first, you might not know you have a Calizion as there is little or no pain because they are not usually painful and might last more than a few weeks. So, basically, if you have a Calizion, you will only feel pain for the first week, but Calizion will still be there for a few weeks or even years. Okay, one fact that I need to tell you guys is Calizion often happen to adults rather than kids. Are you curious why someone can get Calizion? Actually, the meibomian glands in your upper and lower eyelids make oil that mix with your tears to moisten and protect your eyes. If the oil gets too thick or if the glands are blocked because of the inflammation, then you may get a Calizion. Rarely, an infection can cause a Calizion. For example, we as women usually wear cosmetic products, right? Such as mascara. Applying mascara without a proper cleansing will cause oil to clog the eyelids and result in Calizion. This is actually based on my true experience. Okay, this is true guys, where I needed to undergo a few times of surgery to remove the Calizion in my eyes because of the Calizion in my eyes did not disappear in a few years. This is because I often wear mascara but I did not wash it well and caused the oil to accumulate and form Calizion in both of my eyes. At first, I just thought it was just a stye, but over time the pain disappeared. So it is very important for us to be able to distinguish between stye and Calizion, guys. Do you know what happened to the untreated Calizion? Firstly, when you don't treat a Calizion, it will tear and mild irritation can occur due to the clogged glands needed for healthy tears. Secondly, you get blurred vision when the Calizion is large enough to press against the eyeball. Next, typically it will disappear without treatment, but within several weeks to a month, they will often recur. Moving on how you can treat your Calizion. First and foremost, Calizia often goes away in days or weeks without treatment, but certain things might speed the process. We will start by the medical treatment. When you realize that your eyes actually do not get stye because it is on the eyelids for too long, even if it does not hurt, you still need to see a doctor to make sure whether it is Calizion or not. They may want to check it and tell you how to take care of it to help it heal. Okay, they can also suggest certain eye drops or cream to use. If the other treatments don't work, your doctor can prescribe medicines or give you steroid injection, or we call cortisone, to help clear up the problem. In several cases where the Calizion has spread to both of the eyes, then the doctor needs to perform surgery on it and remove the stain and drain it. After the operation, the eyes will be covered with a cotton swab until surgical wound is dry, and the doctor will give antibiotics as well as some gel, creams, and also eye drops to treat the process. The second treatment that you can do is the home treatment, where you can treat your Calizion naturally. As I have mentioned before, a Calizion usually requires very little medical treatment and tends to clear up on its own within few weeks. In the meantime, it is important to avoid squeezing or popping the calazion, as this can increase the risk of an eye infection. However, there are several safe ways to promote drainage and speed up the healing process. If you do not want to see a doctor, then you can try to do warm compresses. Do you know that applying a warm compress to the affected eye can actually help soften any hardened oil blocking the gland ducts? This helps the ducts open the drain more effectively, which can relieve irritation. The steps are to soak a soft, clean cloth or cotton pad in a bowl of warm water. Wring out any excess liquid, then apply the damp cloth or on pad to the eyelid for 10 to 15 minutes. Next, continue wetting the compress often to keep it warm. And you need to repeat this several times a day until the swelling goes down. However, there are still several safe ways to promote drainage and speed up the healing process. If you do not want to see a doctor, then you can try to do warm compresses. Do you know that applying a warm compress to the affected eye can actually help soften any hardened oil blocking the gland ducts? This helps the ducts open the drain more effectively, which can relieve irritation. The steps are to soak a soft, clean cloth or cotton pad in a bowl of warm water. Wring out any excess liquid, then apply the damp cloth or pad to the eyelid for 10 to 15 minutes. Next, continue wetting the compress often to keep it warm. And you need to repeat this several times a day until the swelling goes down. The next home remedy you can do on your own is to gentle massage. All you need to do is gently massaging the eyelids for several minutes each day. Can help the oil ducts drain more effectively. Before doing so, ensure that the hands are cleansed to reduce the risk of infection. Once the calazion begins to drain, keep the area clean and avoid touching it with bare hands. So, based on my explanations, are you aware that you have experienced calazion before? If ever, do not be afraid, because the most important thing to do is we need to keep our eyes clean and do not be afraid to seek help from a doctor.